So yeah, thanks very much, Kari, and to CP Achieve for having the Victorian Health Transition Services as part of the webinar series today. We're excited to be presenting to you today and hope you find it interesting and helpful. Our last slide will have the contact details for all of our services, should you wish to contact us after the presentation. Today we've got myself, Claire from Barwon Health Young Adults Transition Service. We've got Stacey from Monash Young Adults Transition Service, Veronica from St Vincent's Transition Service, and Robin from Bendigo Health Young Adults with Complex Needs Service. And we've got the logo up there for Royal Melbourne as well. They do have a transition service, but they're predominantly spina bifida clients. So didn't come with us today for this CP Achieve presentation. So we'll forward on now. Stacey's going to have a chat to you about the differences between children's and adult healthcare.
Thanks, Claire. Hello and welcome. I'll be talking a little bit about the differences between adult and children's healthcare. And I guess the best way I could think of to describe it was with a little diagram. So if you can imagine children's health services as being a pond that's not too crowded, and with young people with cerebral palsy being kind of a large user of children's healthcare services, compared to other children. So you've got a lot of appointments, a lot of specialists, a lot of procedures. So the children's health services are well set up for you. They know your needs, they know you well, and the sort of service wraps around that and supports you well in that space. Contrast that with adult healthcare services, and you can see that you, the little yellow fish, are in a much more crowded pond with a lot more busyness around you, and with other users of the healthcare system in adult services that use them a lot more frequently than you do. And I guess with that, they're not as well set up. They don't know your needs as well. And so it feels a little bit more fragmented and a bit more kind of like a lost, it feels a bit more lost in the system in adult services. So that's kind of the little diagram of what it looks like. And I'll go through some of the bigger differences on the next slide. So sort of narrowing it down to the biggest sort of differences between children's and adult healthcare for young people with cerebral palsy. In children's healthcare, it's a much more family-centred kind of model. So you're seen as part of your family. The doctors will talk mostly to your parents and carers, particularly when you're younger, and then they'll start to talk more to you. And children's services, children's hospitals in particular, are really well set up for parents and family to stay during admissions with single rooms and nice spaces for families. In adult healthcare, it's much more patient-centred. So you're seen as an individual, independent, or sort of independent, more independent from your family. The doctors will talk mainly to you, and in adult services and adult hospitals in particular, rooms are not set up for people to be able to stay, particularly overnight. Waiting rooms are not as well set up for families or for equipment, wheelchairs, that kind of thing. In children's healthcare, it's your paediatrician, that's your go-to person. In adults, your GP is really going to be your go-to person. So it's really important to have a good GP that knows you well and that you get on really well with and feel comfortable with, because they will become the coordinator of your care in adult services. In children's health, there's a lot of multidisciplinary teams where medical teams and allied health professionals work together and they communicate with each other. There's more meetings, they sort of work in the same place. You can go to one place and see everybody you need to see. In adult health services, it's a lot more single discipline. So the medical and allied health teams don't work together as much. You may not be able to see people on the same site. You might have to go to different sites. And the other thing, because there isn't that same amount of cross communication, you're the person that they rely on more to be able to provide them the information they need. And finally, in paediatric services, there's often a coordinator in the service. So if you miss an appointment, they'll call you up, they'll ask how you're going, and they'll make you another appointment. In adult healthcare, that doesn't happen so much. Referrals often need to be followed up. You've got to call and say, did you get my referral? And then, you know, if you miss an appointment, you've got to call and say, can I have another appointment? So there's a bit more of an onus on the patient, the person using the service, to be on the front foot with these kinds of things. So with more information about the transition process itself, we've got Veronica. I'll hand over to you.
Hi everyone. I was hoping to touch on what our services consider when supporting young people in their transition from the paediatric system into the adult healthcare system. Whilst transition can be identified as a purposeful, planned process, it can also be seen as a time of uncertainty and change for individuals and their families. The aims of transition are to provide high quality, coordinated, uninterrupted healthcare, to promote support and guidance for parents and carers, promote skills in communication, self-care, self-determination and self-advocacy, and to maximise lifelong functioning and potential. There is not a one-size-fits-all process for transition of individuals from paediatric health services into the health system. Many services may vary the amount of time they hold on to a patient before it's seen they're ready for discharge. We have found that people have really, I suppose, been used to being held by the paediatric services. You know, our Children's Hospital in Victoria offers an amazing service to a lot of our patients before they come to us, and they receive all of their medical and allied health input all in one place. And then they need to prepare for what can seem like a fragmented adult system. In the previous CP Achieve webinar, we had the privilege of hearing from Lachlan Dosa, who shared his personal story about moving out of paediatrics and into the adult health system. Readiness for transition can vary from person to person, so an individualised approach is really important. It's not uncommon for some people to be involved in both healthcare systems, especially if there are outstanding needs such as waiting for surgery, but other areas of specialist care may be transitioned in the meantime. The main feedback people have provided is the overwhelming feeling of needing to take on their coordination of their own healthcare. The role of a good GP becomes really crucial in having that central point of care for transfer of information. Our service has seen that those patients who are linked in with a really good GP before coming into the adult health service has found the whole process a lot easier to navigate and transition into. At the Young Adult Complex Disability Service, our initial contact with our new patient is our first question is, who do we need to be talking to for our initial assessment? So whereas in the children's system, the family as a whole would have been included, but in the adult healthcare system, this can differ. There's questions around consent and capacity, decisions about who might be the key contact for the hospital, the individual or a family member. We will touch on advanced care planning and future life plans as well. So there's a lot to be thought of. Whilst the intent of the initial contact may be sharing information and deciding on suitability for the service, sometimes what can be more important is to establish a genuine relationship with the young person, their family or carer, to assist with them to feel engaged and supported by the adult healthcare service. A really important part of transition is noticing what else is happening in the family system. Family members are adjusting to changing roles. Our person may want to take more ownership of their lifestyle decisions and healthcare needs. They may be considering what's next, which may include day programs or increased hours of support workers coming to the home, employment, further study, or even moving out of home. The young person and their family or carers are reassessing their support needs whilst shifting medical and allied healthcare from paediatric and education-based supports to adult healthcare and NDIS funded care. Parents or carers may also be beginning to consider what role they play in the young adult's future and may begin to reassess their own needs. We hope that by the time transition has occurred, that young adults and their families and carers have felt supported through the process and are well linked into the adult system when it's time to say goodbye. So transition is a massive process, but we really hope by considering all of these things that families can feel quite held and supported in the process. Thank you.
Hello, my name's Robin and I'm just going to talk a little bit now about the health and NDIS services. So firstly, I guess our transition services across Victoria are all part of health services, so part of the public health service. So we aren't actually delivering NDIS services as part of transition programs. So many young people with CP are already linked into the NDIS, and others may require support to learn about what the NDIS can offer them and possibly to register. The NDIS firstly supports people with disabilities to live the life of their choice with the necessary supports they need to meet their goals. So it's a very goal-based system. Our transition services can assist young people in two ways. So firstly, with the registering for the NDIS, if this hasn't already occurred, and secondly, with helping young people and their families to plan for requesting the additional supports as they make decisions about their life as a young adult. So for example, this might be getting the necessary supports to help them to engage in community or leisure activities, perhaps without their parents. Maybe it's to commence attending a day program, to do some further study, or perhaps seek employment. This will be quite variable depending on the individual. We can also help young people and their families to learn how to navigate the way in which the health and NDIS services work together, and this can seem quite tricky. So it's important that young people and their families understand that once they commence services with the NDIS, that they are still able to access the health system and will continue to benefit from this throughout their lifespan. So for example, a young person with CP may need health supports through a hospital setting for managing their spasticity, or perhaps to have some Botox injections. They could have some problems with skin integrity, or perhaps even need to access some public dental care. So health services will play an important role, not just in when you might need to attend a hospital for care, but also in the monitoring and support of your health and wellbeing over time. This is where having regular reviews with your GP, or as Veronica and Stacey have explained, the go-to person in the adult space, is really important to ensuring that you're accessing the health system when it's needed for your health and wellbeing. So the key message to leave you with is that the NDIS and health systems work together, whether that be public or private, to support your needs as a young person moving into adulthood with a disability. I'm now going to pass over to Claire, who's going to present a case example.
Great, thanks, Robin. And we thought it would be helpful to have a case study or a case example to show you how a typical transition service might work with a young person and their family, bearing in mind everyone's going to be different. So your journey might look a little bit different from this one, and that's fine. So in this case study, we have an 18-year-old woman who was referred by her paediatrician into a health transition service. She has a history of cerebral palsy. She had lots of orthopaedic input more as a child, not so much as a teenager, and not for the last couple of years. And she told us in her initial session as well that she's got a history of learning difficulties and anxiety as well. So she comes in for an initial appointment in a transition service with the rehab physician typically, and the transition team. So majority of the teams are multidisciplinary teams, so that means lots of different disciplines in the team. There's usually physio, OT, speech and social work. And in that initial meeting, the clients identified a few different goals, and they are to get her motorbike licence, to get her hip pain reviewed, as well as to start an exercise program and improve her walking, to access the NDIS. This was back when the NDIS was getting rolled out and she was not yet part of that program, and to gain employment as well, to get a job. So actions that the transition service undertook with this young lady were, from that initial meeting, the team doctor organised some pelvic and hip x-rays, because it had been some time since this had been done, and the client was reporting pain as well. So the physio and OT did a physical assessment as well, and the team physio supported the client to access her local gym and the personal trainer there while we're waiting for NDIS to come through, and also start the exercise program as well. The client was referred to the spasticity clinic in that transition service as well, and organising local orthopaedic specialist referral as well. So that was done in consultation with the client's GP, remembering from Stacey and Veronica's presentation that the GP is going to be your new go-to person, and he's going to be the person that supports those referrals and also feeds back information from specialists as well. Based on the client's reporting of her learning difficulties and her anxiety, a neuropsychology assessment was organised to guide employment and study prospects and help us look at what kind of supports were going to be needed and what was going to be most appropriate for this young lady. And with all those recommendations from the physical and the neuropsychology point of view, the social worker supported that NDIS application with the client and her family. As we all know, that took a little bit of time to happen. So during that time, we encouraged regular contact with the client's GP to really build those skills of independence with her GP and be more confident in approaching and having a chat with her GP. And we did a lot of skills work as well as to how to ask questions of a specialist, how to ask questions of a GP, how to feel comfortable talking about your medical condition, talking about the things that you might need modified or things that you need to make life easier for you. And once that NDIS plan came through as well, education and skill development around how to find an NDIS therapist, what questions to ask, how to move on from a therapist that you might not be happy with, or how to find someone that's going to meet your needs, be specialised enough for what you need. And also education around the licence application process, modifications that she might need for a car and a bike, and how to advocate for those in her NDIS plan. And that whole process really took about 18 months. So it's definitely not a quick process, and each person and family is individual. Some it might be a couple of sessions, some it might be 18 months to a few years, and that's completely normal depending on you and your family. So finally, we were really just doing a call to arms for young people and their families, really just to let you know that there is a health transition process, and it can take many years, and it can start as young as 14, as we saw with Lockie in the previous transition presentation. So we really urge you to use our contact details, find your nearest health transition service and get involved. Most importantly, have a think about how you want your transition to look like. Don't be afraid to talk to your current therapist, talk to your current paediatrician or your GP, and you can even start by asking them the simple question of, will you still see me once I turn 18? And that can start that conversation. They might say, well, yeah, look, actually we do. We see people across their lifespan. Or they might say, actually, we really only see paediatrics. Come 17, 18, we'll look at how we're going to transfer you to adult therapists. And that can start the ball rolling as to how much support they're going to give you in that process. And also, that's where we come in. That's our service. So we really look forward to meeting you and working with you as well.
Great. Well,
so these are just these are a summary of all our services. So you can see Barwon Health there. We accept people from 14 years of age, and we cover the Southwest Victorian region. So I'll hand you on to Stacey to talk a little bit about Monash.
Sorry, the process of unmuting and starting videos. Yes, so Monash, the transition service is based at Kingston Centre, and we cover East, Southeast Metro, as well as sort of the eastern kind of half of regional Victoria. And we accept referrals from the ages of 16 up until 25. Is that the end of the presentation? Oh, sorry, Veronica, did you want to go through St Vincent's?
Yep, sorry, I'm just trying to get my video on. It's not wanting to, there we go. Okay, sorry about that. Yes, so at St Vincent's, our program is called the Young Adult Complex Disability Service, which is quite a mouthful. Sometimes it's shortened to YATS, got that acronym from somewhere. We're a statewide service and we're based at our Fitzroy site. So sometimes we may do, because we're statewide, make the use of telehealth and things like that. But sometimes people even travel across the state to our site. We accept referrals from young people. It's got 18 here, but we do have people younger than 18 come in. Generally 17-ish, up to the age of 40, we accept referrals. Predominantly cerebral palsy type presentations, which also require complex medical input for complex medical and physical needs. So yes, we would love to hear from you if we can support you with your transition.
And just from a Bendigo Health perspective, so ours is a Loddon Valley region based referral. However, sometimes we go a little bit further south in our coverage as well. So young people aged between 16 and 25 is the predominant age group in our transition service. We have a central intake service, which is where the email address is for, but I've also added there my contact number if people have questions about the service in general prior to making referrals.